Imagine seeing a blood pressure reading that is unusually high, perhaps one of the highest you have ever seen. It is natural to feel a sense of alarm, and your mind immediately races to one crucial question. Knowing when a high reading requires a trip to the hospital is incredibly important. Generally, hospital admission for high blood pressure is reserved for a condition called a hypertensive emergency. This is where extremely high blood pressure causes new or worsening damage to your body's vital organs. While any very high blood pressure reading needs attention, it is the presence of specific symptoms that usually dictates the need for emergency hospital care. The core mechanism differentiating a true emergency from simply very high blood pressure, known as hypertensive urgency, lies in whether there is evidence of what doctors call target organ damage. If your blood pressure is extremely elevated, let us say 180/120 or higher, but you have no symptoms of organ damage, it is typically a hypertensive urgency. Your doctor will need to adjust your medication or treatment plan quickly. However, if those high numbers come with alarming symptoms like severe headache, chest pain, shortness of breath, sudden vision changes, numbness or weakness on one side of your body, or difficulty speaking, that indicates a hypertensive emergency. These symptoms are clear signs that the high pressure is actively harming your body. So, what should you do if you get a very high reading at home? First, take a moment to rest quietly, and then recheck your blood pressure after a few minutes. If the reading remains very high, for example, consistently 180/120 or higher, and you are experiencing any of the severe symptoms we just discussed, such as chest pain or sudden vision problems, do not wait. Call 911 or proceed to the nearest emergency room immediately. If your blood pressure is very high but you are not experiencing any of these symptoms, contact your doctor right away for urgent guidance. They will advise you on next steps, which might include an immediate office visit or medication adjustment. Understanding the concept of target organ damage is key here. Your body's vital organs, including your brain, heart, and kidneys, are particularly vulnerable to the intense force of extremely high blood pressure. Left unchecked, this can lead to serious consequences such as stroke, heart attack, or kidney failure. In a hospital setting, medical professionals can closely monitor your condition and administer intravenous medications to carefully and safely lower your blood pressure, protecting these critical organs from further harm. This controlled reduction is essential, as lowering blood pressure too quickly can also be dangerous. Ultimately, while a very high blood pressure reading can be alarming, it is the combination of extreme numbers and specific symptoms of organ damage that signals the need for hospital admission. Knowing these critical warning signs empowers you to seek immediate professional medical attention when it truly matters, helping to protect your health and prevent potentially life-threatening complications.